Hi everybody, welcome to Avana Plastic Surgeries Live. I am Gigi and I'm here with Dr. Golio.
Good morning. Good morning everybody.
We're actually streaming live on Instagram and on TikTok. So if you have any questions, I'm going to be here. I'm going to be answering all of them. And we already have a couple of questions for Dr. Golio. One of the first things I want to do is wish you all a very happy Thanksgiving with your family and your friends. And Dr. Golio, what do you have planned?
We are going to have a nice quiet afternoon with the family.
Okay, very nice, very good. And this is actually you just moved to Miami a little while ago.
Yep.
All right.
In July.
In July. And you were can you just let our followers know a little bit about you?
I was in New York, Manhattan, actually. We used to live in Manhattan and moved down to sunny Florida.
All right. Well, it's a fantastic place, so I don't blame you. And the weather is a lot nicer right now.
Much, much better.
Okay, so we have a couple of questions in regards to faces. So let's talk first about something that's really popular right now, Ozempic. Yes, okay. Ozempic, the weight loss miracle drug, is now causing some side effects that people are worried about. Do you want to talk more about it?
So there's a couple of things with Ozempic that you have to realize. Number one, from a safety profile, you must stop Ozempic 2 weeks prior to any surgery. Okay, very important because it's not letting your stomach contents empty. So they're having problems with aspirational issues during surgery. Oh. So 2 weeks prior. The other issue cosmetically that we're having an issue with Ozempic is these people are losing so much weight that they're losing all the volume in their face. All right? And it's actually, they coined the term Ozempic face.
Right.
So the problem is youth is volume. Always has, always will be. So when you start to lose volume in your face, you start to age prematurely. And that's one of the things that people get very concerned about. Even though you now have a very slim body, your face
has aged
dramatically. It's proportionally slim. So they're not happy.
Okay, so what can we do here at Avana? What can you do for those patients?
So one of the things that we can do for these types of patients is we can give them fat transfer. And depending on what age bracket they're in, we can either do mid-face lifts, brow lifts, or even facelifts. And what that'll do is that will help restore the youthful volume. We also can do J-plasma to tighten the skin. So we can do fat transfers to help give you that volume back. We can do J-plasma to tighten the skin. And we can put the skin back where it originally was.
Okay, and I'm glad that you actually mentioned fat transfer because some people think that you can only put fillers in your face. But fillers, as you know, dissolve.
Dissolve over 6 months.
Right.
Even no matter what filler you have, it's gone by 6 months.
Exactly.
Okay, except for the calcium, the hydroxyapatite calcium ones.
So a fat transfer would be a lot more of a permanent...
It's your own natural tissue. And if you lose weight, you'll still have those fat cells there. And if you gain weight, you'll still have that, they'll grow with you.
Okay.
So
we actually have a patient of yours who says, Dr. Golio, I'm very happy with my facelift that you did on me. Wonderful. And I have a question as to how long does it take to heal? Numbness on top of her lip and nose.
Okay. So the numbness is from the facelifting can last anywhere from a few days to a few weeks.
Okay.
All right. And it all depends on how well you take care of yourself as well. Typically that numbness will diminish over time. And most people will feel the numbness in their lip or their teeth, and that's from me manipulating the nerve in this area from the mid-facelift primarily. When that occurs, as long as you can feel your teeth with your tongue, you know that nerve is working and will come back over time. So it could be anywhere from as quickly as 7 to 10 days, sometimes 2 to 3 months. It depends on the person.
Okay, wonderful. And I hope that answered your question. And do you do any jawline procedures?
Yes, we do. We can sculpt the jaw. In certain cases, we can actually do mandibular implants to give you that nice angular jaw if you don't have it. We can also advance the chin to make sure that a lot of people have issues with their chin, and that's part of facial symmetry. So they may look good straight ahead, but it's their profile that's affected. When you have that, what we can do is we can actually cut the bone and move it forward. And that's better than an implant, and I'll tell you why. Because the bone is attached to the muscles. When you move the bone forward, the muscles move with them and give you that nice angular jawline that you'd like. When you do an implant, it doesn't do that because the muscle stays where they are. The implant can't move the muscles.
Absolutely. And how many years have you been doing
surgery?
Facial procedures and surgery in general?
It's over 20 years.
Over 20 years, fantastic. So we have over 20 years of experience here with Dr. Golio here at Avana Plastic Surgery. And any questions you have about surgery, about faces, let us know. He's actually doing a rhinoplasty very soon.
Yes, shortly.
I'm very excited to see that. And can you tell us a little bit more about who would be a good candidate for a rhinoplasty,
Well,
and who's not a good candidate?
Okay, so people who are not happy with their nose and they feel that their nose doesn't fit their face, those are good candidates, all right? But the key is you want to make sure that you have the most natural look possible. So different people have different noses, different ethnicities have different noses. So what we try to do is we try to tailor it for your face so that you look your best, most natural. And rhinoplasty is a great procedure. We've been doing it for years, and there are different types of rhinoplasties. There's the primary rhinoplasty, there's a secondary rhinoplasty to fix the work that has, if you weren't happy with the first one. And there are different ways we can do it. Some people have curved noses. There are certain techniques to straighten the curved nose, which is a very difficult procedure. But we can do that and accomplish those and give you a much straighter nose than you might have originally had.
Okay.
So there are different variations to the procedure.
Okay, very good. And a brow lift is something that a lot of people are very interested in, because they feel that when their eyebrows are low, they look very tired.
Correct.
So how can we go into that?
Okay, so brow lifts are very good procedures in restoring a youthful appearance to everybody. Not only that, there's some functional components to it as well. So if you've noticed that your eyes are getting heavier and your brow is trying to fall from where it originally was when you see it in photos, what we can do is we can lift it. And the way we lift it is, we lift it from an incision behind your hair. We do a geometric pattern so it's hidden in your hairline. The reason for that is your body can't see those geometric patterns. And what we'll do is we actually will remove extra skin. The problem with brow lifts anywhere else is they typically fall. Okay. And most patients will complain, Doc, you know what, I did a brow lift a year ago, 3 years ago, 5 years ago, and they fall. The reason why they fall is you don't remove any skin. Okay, so what I do is I will remove 3/4 of a centimeter of skin.
Tiny.
Yeah, but enough
big
that
difference.
It won't fall. Exactly, and when they anchor it to the bone and it doesn't fall anymore.
And what's your favorite procedure to perform?
Oh gosh, I like them all. To be honest with you, there's nothing in particular that I have a favorite with.
What gives patients more bang for their buck?
Oh, it depends on the age group.
Okay.
Okay. So young women and younger.
So let's say you're pushing 40. You're you're getting to 40.
All right. So if you're getting into your 40s and you're starting to notice you're looking a little tired, and you're starting to see a little bit of the fat pads herniating, right, the mid-face right here. That's the first place you age. Remember, gravity's always pulling down. So what you'll notice is the nasal jugal fold will start to go from a horizontal to a 45-degree angle. And you'll start to see a little bit of the herniations of the fat pads. Once we lift that, we restore the mid-cheek back to its proper position. That goes away. Takes 10 to 15 years off people.
So if I do it in a few years, I'll look 30.
There you go.
Or late 20s.
Right.
I'll take it.
Your husband may not be happy, but...
Well, so thank you guys so much for joining with Dr. Golio. If you have any other questions that Dr. Golio can answer for you, let us know in the DMs. We will be responding to all of them in our stories today. And let us know. Thank you so much again. And I look forward to doing this next week with him. Okay, guys, so now we actually have Dr. Mameniskis coming in with us. And for all you Mameniskis dolls, future, present, past ones, we've got Dr. Mameniskis. How are you? Good to see you.
Good to see you, too.
Happy Thanksgiving.
Thanks, same to you.
And what are you and Jody doing this week?
I'm the cook.
You're the cook. Well, we know that. You
Sort
love
of.
to cook.
We're ordering a lot of things in, and I'm doing we're just doing like a stuffed turkey breast.
Oh, perfect.
Only 6 people coming, 6
Yeah.
of us. So
What are your sides?
All the
Those are
the green
so
beans, the
important.
The spinach thing, the cream spinach,
Okay.
cranberry.
Yeah, we're catering everything because I have a newborn and a toddler at home. So there will be no cooking, and it's all going to be really delicious, and first time that we're doing that. So I hope it's going to be fun. I'm sure it's going to be.
Yeah.
So, guys, happy Thanksgiving. I wanted to say that again to you guys. If you weren't tuning in before, I hope you girls are having a wonderful time with your family. I hope everybody in general, everyone's with their family and their loved ones. We wanted to give you guys this opportunity to talk with doctors and ask them the questions that you may have. And I am here with Dr. Mameniskis. Get the questions rolling in. There's a lot of patients that want to know about your BMI limits. So let's go ahead and discuss that.
For most procedures, 35 is my limit for most procedures. Occasionally, it's slightly higher in certain procedures. That's a patient-by-patient basis. That's based on medical history, lack of medical problems, and age, and a lot of factors like that.
Okay. Who's a good candidate for a combo procedure like a BBL and tummy tuck?
Good candidate. Once for that procedure, I'd like the BMI to be a little bit lower. 32 is my goal, but I'll take a little bit above that in some patients, once again, if they have very little medical history. And
I'm
a
happy.
patient who just wants a great result.
Exactly. And you know, a lot of patients have questions when they're doing a procedure, a combined procedure with their BBL. They want to know how are they going to recover since they can't lay on their butt. What do you say to those patients?
The two main things are, one, they can buy the BBL cot. It's like a bed with an aperture, a hole where the butt is, and patients can lie pretty normally with that. Short of that, I usually recommend patients to be on their side,
Okay.
well padded, so whatever fat I put in the hip area doesn't get compressed. So pillow here, and change sides right to left, and usually I've had good success with that.
A lot of our patients have purchased the chair, that zero gravity chair, and that seems to be very popular with our patients. And about recovery, now that we're in the recovery talk to us about massages. Why is it so important for you, for your patients to do massages? We're very adamant about that here.
It's very important. The massages help the lymphatic flow, which takes away the swelling and maximizes the smoothness of the result, and it feels good.
Yeah. And what is your favorite procedure to perform?
My favorite is the mommy makeover.
Yeah.
Because it creates such a big change for patients, and
Absolutely.
Really overwhelming change overnight. And I have a lot of weight loss patients in my practice here, and that's even more of a startling result for them. So,
Absolutely.
so
A
it's
lot
fun.
of loose
It's fun.
skin is
Yeah,
removed.
yep.
Fantastic. And then with the tummy tuck, you're not just removing skin. There's a lot of work that you're doing under the hood.
Sure. I mean, there's sculpting liposuction that's done, the muscles repaired, muscles tightened. Yeah, so it's
Good, because that's a lot of things those are some things that people don't know about, that when you do a tummy tuck, it's actually twofold. You're not just working on the skin, you're repairing muscle.
right. Exactly. Yeah.
And in terms of breast, let's talk a little bit about breast augmentations. Saline or silicone, which one do you prefer, and which one do you use on which patient?
I use both. Many times it's just patient preference. Patient wants a certain implant they think is going to give a certain look that they want. If patients want a softer, more natural look, I usually recommend a silicone gel implant or the cohesive gel implants. If patient wants a lot of high fullness and a lot of really the implant sort of being out there, then saline might be a good choice.
Okay, fantastic. For a patient that needs a tummy tuck but also wants a BBL, which one do you recommend they start with? If they don't want to do it together.
If they don't want to do it together, I prefer the tummy tuck first.
Okay.
Because doing the liposuction first creates a lot of scar tissue in the abdomen, which creates some of a problem sometimes to get the flat pulled down in the right position. So if you do tummy tuck first, you can do full liposuction all the way around,
Okay. So talk to me a little bit about the cases that you've done this week. Which one has been your favorite?
Once again, my favorite case was done just a few days ago is a weight loss mommy makeover for a woman who really it's.
How much weight had she lost?
The picture should be going up on my Instagram soon. It was 100 plus pounds.
Wow.
And she had just lots of excess skin, and the breast, she just wasn't feeling happy about it. She was only in her early 40s, but just felt that just her life wasn't where she wanted to be, and it's a big change. And she's really happy. I'm happy.
And that's going to
Her
be on your.
husband's happy. He loves it. Yeah, yeah.
And that's going to be on your
Yes,
Instagram.
Yes.
Fantastic. So make sure you tune in to his Instagram. What is our Instagram account?
At Dr. Mameniskis, mine.
Fantastic. So if you want to know the results, if you want to see those results, make sure you're following Dr. Mameniskis on his page. Thank you so much. I'm not going to take up much more of your time. I know you're going to see your patients.
Right.
And it was great to speak with you and
Great
see
being
you.
with you. Happy Thanksgiving. And
So, guys, we are going to have one more guest, and he is a surgeon that has been with us the longest. It is Dr. Moradian, and Dr. Moradian, please come.
How are you?
Very good. How are you?
Hey guys, how are you guys?
So, Dr. Moradian, I wanted to start this off by saying Happy Thanksgiving, and we're talking about what your plans are for Thanksgiving. What are you doing this Thanksgiving?
Thanksgiving, I am staying home, have my parents in town, my in-laws, my kids, so my first Thanksgiving with my daughter, and second with my son. So
Are you cooking?
No, I don't cook at all. No, my wife, her parents, my parents, no,
Anything being catered in?
no, we cook everything in-house.
So, yeah, we normally do that, but we always end up fighting in the kitchen. So it's the first time we're catering everything.
Oh, that's good.
Yeah.
Well,
Oh, we have 2 kids too and a newborn, and it's just, I don't want to be stuck in the
yeah,
kitchen.
but you have a newborn.
Yes,
So
newborn.
Mine a little bit older, so.
So we wanted to discuss what's the difference between a regular BBL and a skinny BBL.
So regular BBL and skinny BBL, really it's in terms of how much fat we're taking off compared to the patient's BMI. Usually if the BMIs are under 24, it's kind of a skinny BBL. There's no definite term for it. It's kind of a term we surgeons made up, especially those who do BBLs a lot. So usually it's a BMI that's lower than average, so 24, 25 or less. Sometimes it can be even 22 or less, but it just depends on the amount of fat that we're taking off, where we're putting it in the patient to make them more proportional.
Okay. And for those patients that are not decided between a tummy tuck, a BBL, which one to do first, what do you recommend?
Well, it depends on your wants and needs. What exactly do you want from cosmetic surgery? Do you want a flatter abdomen, or do you want more shape, curves? Do you want more projection in your hips, butt? Right. So if you want a flatter abdomen, say you had 2 or 3 kids and it just kind of hangs, you can grab it, then I would do a tummy tuck. If you want more curves, projection, look better in a dress, sometimes a BBL is the right operation for you.
Okay. And speaking about having 2 or 3 kids, we actually have a question. After a cesarean, how soon can I have plastic surgery?
So after C-section or giving birth, I recommend at least waiting 9 to 12 months. This has 2 big factors. One, it allows your skin to kind of snap back to where baseline was before. And 2, it helps lower the risk of having blood clots after surgery. During pregnancy and after pregnancy, you're in a hypercoagulable state where you tend to clot more, and having surgery too soon can increase that. And why push the limit? So
Right.
In cosmetic surgery, we kind of get used to pushing the limit, getting the best results. Sometimes it's better to slow down, let time pass, and then come and do surgery.
And safety first?
And safety first, exactly.
Okay. And after a gastric sleeve, because I'm not sure if you girls know this, but he is also a bariatric surgeon. And a lot of patients get bariatric surgery when they're not a good candidate for plastic surgery, or they want to lose weight before doing plastic surgery, and then they come and see us a little while later. So after getting a bariatric surgery, when can they have surgery?
So usually I like to wait at least also a year after having either bypass or sleeve surgery. Now we're seeing a lot of medications that come out, and usually I would also wait at least a year, although that data is kind of newer. It allows your skin to, again, get back to some sort of baseline so we can establish what we need to take, what we're working with. So that's usually the time limit I like to wait after having weight loss surgery or losing anything over 50 pounds.
Okay, very well. Hope that answered your question for you. And how long does bruising last?
Well, it depends on the
Depends on
patient.
the patient,
Depends on
place.
the complexion of the patient. Usually bruising lasts anywhere from 1 to 4 weeks.
Okay, very good. And in terms of patients, you mentioned these weight loss drugs. What is your take on them? And if you are taking them, how long should you be off them before having surgery? Because a lot of our patients to lose weight are on Ozempic, they're on Manjaro, they are on phentermine. What is your take on these as a surgeon, and what do you recommend our patients?
So medications like semaglutide, Manjaro, things like that, usually you want to be off those medications at least 2 to 4 weeks if you're going to have general anesthesia, because one of the things that we worry about is vomiting during surgery or before you get intubated for surgery. There's medications that we can do, but data out there is suggesting at least 2 to 4 weeks after stopping those medications to have general anesthesia. Phentermine is a different class of weight loss medication that you lose weight, kind of a different mechanism. That is usually surgeon-based, but I usually like to at least 1 or 2 weeks also but it's more the cardiovascular risk profile with phentermine compared to the other medications.
Okay. And in terms of recovery, massages, what do you recommend for your patients?
So massages, all my patients, I recommend doing massages every day for the first week after really any surgery besides a breast augmentation with implants. Because that can be done usually manually, the patient can do it themselves. Sometimes a breast lift, it depends. Really, the majority of the time, tummy tuck, lipo, BBL, recommend doing massages every day for the first week. And then after the first week, 2 or 3 massages per week for 2 or 3 months after.
Okay. Combo procedures. A lot of you don't know this, but Dr. Moradian does combo procedures on the right patient. Let's talk about which combo procedures they are and who's the right patient for them.
So combo procedures, I do, the traditional mommy makeover, breast lift with or without implants, with a tummy tuck. I do a lot of the tummy tuck and BBL. It just kind of depends on the patient. I'm doing a kind of a newer abdominoplasty where the incision is much smaller and the belly button, able to keep your same belly button but pull it down slightly, sort of like a mini tummy tuck. But with a mini tummy tuck, you usually don't repair the entire muscle wall. In my mini tummy tucks, I do repair the entire muscle wall. I use special instruments to help aid that. So that's kind of where I'm differing with that technique versus other surgeons. For a BBL tummy tuck, usually I make sure patients really no previous liposuction or BBL procedures. They haven't had previous tummy tucks. They're going to stay in Miami at least 7 days after surgery. It's very important, really, any surgery I do besides a breast aug, at least staying post-op in Miami for at least 5 to 7 days, 7 days being better for me, just so we can come here, I see you post-op, make sure everything's going well. Because complications happen, wound infections, incisions can open up when patients are traveling back and forth. It's a lot of stress on the body, traveling in the airport. Anyone who's been to the airport lately knows how stressful it is, and that can impact you healing. Just as simple as that. So
we want to see you. It's really important. This isn't like going and buying a new pair of shoes. You're going under the knife. It's massive surgery. We want to make sure that you are taking care of yourself. So make sure that you schedule time not just for surgery, but for post-op as well.
Yes, please. So other candidates, usually it's women who basically are done giving birth and they want to tighten things up, put things where they're supposed to be.
I'm so done.
And that's who would do a breast lift, mommy makeover, those different combo procedures.
Very good. And in terms of breast lifts, saline or silicone for your breast lifts?
Depends. Usually I like to really tailor it to the patient. So if breasts are very uneven for a breast augmentation, I like to use saline because it can change the sizes on demand, match it up a little bit better. But for a breast lift, it really doesn't matter because I can take out tissue to accommodate for the difference. It just depends on the patient, what they prefer touch-wise. They usually say silicone, gummy bear implants feel more natural, saline don't. However, I've done a lot of breasts over my time so far, and sometimes it's very difficult to tell if it's saline or silicone. So I don't know if that rumor kind of holds up the test of time.
Okay. Have a patient that is going to get married July 2024. So
Yes.
Congratulations. And they want to get ab etching done. So when should they get it done so they can be bikini ready for their honeymoon?
So ab etching usually in patients with no previous lipo, haven't been pregnant, good skin elasticity or laxity. If you're getting married, I would say 8 weeks before. So probably 8 weeks before I would do it.
8 weeks. Fantastic. And can you combine an ab etching with J-plasma, for example?
You can, but it's very tough. If you're using J-plasma, you're usually not a candidate for ab etching. And the more that you do to the skin, like J-plasma ab etching, the more likely you are to cause
Is a good candidate for J-plasma.
J-plasma candidates usually patients that have lost their skin laxity. Basically, it's too much, very lax, excuse me. And patients who don't want a tummy tuck, who aren't candidates for a tummy tuck, usually the best thing is to come in for a consult, go over you. It's difficult to tell just from pictures. Usually has to be, pre-op exam, have to feel, touch, see. So that's usually a good candidate for that. If it's not too much skin to grab, then usually it can be a good candidate for J-plasma. That can be a barometer.
And where do you use J-plasma?
J-plasma, usually in the abdomen, but we use it in the back also. It just depends. Back's a little bit more tougher for patients to gauge for themselves.
Okay.
So best to come in for a consult.
Okay, fantastic. And let's talk about your BMI limits. So, can you tell us what your BMI limits are for your tummy tucks, your breast dogs, your BBLs, etc.?
Yeah, really all my surgeries are BMI 35 or less. The reason 35 is that number really has been shown to have the least amount of complications post-op. The higher your BMI, the more likely to have complications post-op, wound healing, blood clots. Those all tend to go up, especially in the office-based surgery setting. Mm-hmm. You can do higher BMIs at other facilities, like a hospital, but usually if it's 35 or less, you're pretty safe.
And if you are higher than a 35, let's say you're a 39, a 40, 42, remember, he also does bariatric surgery. Mm-hmm. So he's a bariatric surgeon, and would it be possible to do bariatric surgery with you, lose a wait about a year or so for it to be stable, and then do the plastic surgery?
Yeah, about maybe 10-15% of my patients overall fall in that category, doing the sleeve and then doing the cosmetic surgery after. So it's a great journey to be part of. I'm glad I can do it.
Okay, fantastic. Well, thank you so much for your time. I know you're busy. You got to go see your patients, so I appreciate it. We're going to be doing this a lot more often, guys. This is just the beginning, and I hope you all have a fantastic Thanksgiving with your friends and your family, and we'll be tuning in next week with a couple of other doctors, so stay tuned. Bye, guys.
Bye, guys.